Coming up on Better Health, we take a look at the new nurses' uniforms, which will give the public a clearer idea of the nursing designations while still looking professional and being comfortable.
Hi, my name's Sharon Jones. I'm the Director of Nursing for Surgical Services at the Southern DHB, and I've been the clinical lead for the new nurses uniform project. You're going to want to know why we've got new uniforms. I think it's really important that we're very much launching the Southern District, and this is part of that project. Currently the nurses on the Invercargill site and the Dunedin site wear different uniforms, and our desire is to get them all wearing the same uniform across the DHB and across the district. One of the exciting things is we've actually adopted the same uniform that Canterbury District Health Board has got, and we're wanting nurses to be looking the same so that the general public can see who in fact they're talking with. So we've got a new range of uniforms. They have colour distinction, so it'll tell you who you're talking to, and we're going to have posters up so the members of the public will know if they're talking to a staff nurse, an enrolled nurse, or a healthcare assistant, and that hasn't been quite so apparent in the uniforms that we've got to this stage. These uniforms are really exciting. They've got lots of new technology. They've got silver ions in them, so they're supposed to be better for infection prevention and control. They've also got a Teflon coating, which means that if you're splashed with any fluids or water, they'll actually run off the uniform, and that means it protects our healthcare worker, although we still need to use the personal protective equipment, but this just is an added advantage. I think it's really important that we can recognise the different people who are providing care for patients. It means that you can ask the appropriate type of questions. You need to know when you're talking to someone who's got a proper qualification, and perhaps if you're talking to a healthcare assistant, then that you need to know that you might need to be finding the registered nurse who's looking after the care of the patient, the primary care of the patient. Staff have been really positive about the new uniforms. They're really excited about having something that looks professional and nice and smart. So we're getting lots of good feedback from staff, and we're hoping that our public will feel the same.
Hi, I'm Janet Gray. I'm an enrolled nurse. I've been on Ward 5B for the last 17 years, and I'm wearing an enrolled nurse's uniform which has the aquamarine trim, and it seems to be quite comfortable so far. I've worked in the hospital a long time, so this is my third uniform change actually since I started back in '79, and we're always improving, so it's great. Our first one was a white one with just buttons down the front, which is a bit like a flower set, to be honest. So this is a little bit more of a professional look, I believe, and no, I'm quite happy with them.
These are our new uniforms that we received last week, and it's my first day that I've worn it. Mine's for a senior nurse, which is indicated by the silver trim on the uniform.
The registered nurse uniform is a sky blue top with navy blue trimmings. Uniforms are actually great since they actually distinguish different roles for different people, and it makes it easier for people to identify who they need to talk to. It just makes communication a whole lot easier, and it gets things done quite quickly instead of going to the wrong person and having that person talk to someone else.
The senior nurses, who includes the clinical nurse specialists, associate charge nurses and the nurse educators, will wear a sky blue top with a silver trim.
I'm Vicky Fox, so I'm a nurse aide on Ward 5B. And all the aides wear this lovely wine colour. Good. It's good people can differentiate between nurses and the aides.
It's actually quite a rare experience, and I think we've had our other uniforms for a very long time. Of course, they are historical. They had the Otago District Health Board logo on some of them, and we've moved on from there, and we need a workforce that's easily identifiable as working for the Southern District Health Board, and becoming one across the district is a really important concept for us. It's really important for health professionals to know who they're talking to, and it's important for doctors to know that when they're asking a nurse to perform a task, that it's a registered nurse or an enrolled nurse that can perform that task and not a healthcare assistant. So it's better for communication.